Chiropractic is a tool to decrease dangerous pain medication. Hey everybody, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. I'm coming to you this week with yet another video. This week we're talking about pain medication and if we can prevent our patients from having to take any of the pain medication, or if we can get them off of it if they've been on pain medication for some time before we ever even get them into the clinic as a patient. Trust me, somebody you love needs this information. So listen up. We have lived for decades with the desire to be able to take a pill and get out of pain, and that is so understandable. We're busy people. Nobody has the time to be in pain or to be hurting. Of course, it would be nice to simply take a round of pills and be able to get out of pain while we're still being productive. After all, if we have an ear infection, we can take antibiotics and can go about our business, right? Providing for our families is our number one job, after all. Now, unfortunately, pain has proven to be a worthy adversary, and modern medicine has done little in being able to innovate, adapt, and overcome. In fact, it's quite the opposite. Opioid and drug deaths have been on the rise for about a decade, with over 72,000 drug-related deaths just last year alone. Many opioid addictions originally began with a prescription for back pain. Keep in mind, only a little over 58,000 deaths are directly due to the war in Vietnam. And that number, 58,000 or so, was spread out over a decade, over 10 years. Yet we have over 72,000 deaths in just last year on our hands, but essentially that number is just kind of flying under the radar somehow. Biomechanically, and with regards to the musculoskeletal system, pain continues to be the largest problem we face. Low back pain is now the global leader of disability. Worldwide, globally. It is more expensive to treat than diabetes, heart issues, those big things that we know are very expensive to treat. Low back pain is more expensive, right? The number one cause of disability. Low back pain has increased in its prevalence 54% since 1990. That's amazing. It's only gotten worse, not better. Corticosteroid and epidural steroid injections, they've gone up considerably, but have shown no better outcomes in those that have undergone the procedures. They're not any better. They're doing them a lot more, but the patients aren't getting any better. The same goes for some spinal surgeries, such as the fusion procedures that are so common these days. All of the traditional treatments have been tried, and they've been found in the research literature to be mostly ineffective. What are the answers then, right? Fortunately, you don't have to listen to me for the answer. The United States government and the medical field themselves have been making a pivot in recent years. And what I mean is that they've recognized the shortfalls of traditional medical thinking, and now they're trying to turn that boat around. Unfortunately, it seems at this point to be more than a boat, right? In fact, it's looking more and more like a big, huge, monstrous aircraft carrier. The wheels indeed turn slowly when trying to change the beliefs and age-old habits of traditional medical thinking. Even when the biggest and most powerful organizations within the medical community are the ones leading the charge. For example, the American College of Physicians, one of the nation's largest and most powerful, influential organizations, medical organizations, updated their recommendations over the last few years to include the following treatments as first-line therapies for acute and chronic low back pain. Basically, they're saying do this before you do anything else for low back pain. Exercise, spinal manipulative therapy, massage, acupuncture, heat, low-level laser, yoga, tai chi, and cognitive behavioral therapy. At Creekstone, we offer the first 6 of these therapies right here in one place. And we have forged a network of referrals for the remaining 2 or 3 services that we don't currently offer. The main goal is to give our area's physicians an evidence-based, patient-centered, within the guidelines, smart option for their back pain patients. An option that they can trust will take excellent care of their patients. In addition to the American College of Physicians, the following groups and publications are now in agreement with those recommendations by the American College of Physicians. They are the Joint Commission, the Lancet Series on Low Back Pain, CDC, the FDA, the White House Report on Opioid Abuse, and over 37 state attorneys generals. The overwhelming sentiment here these days is to undergo non-pharmacologic, no pain meds, non-invasive, no surgery, therapies, and to do that first. Yet too many of these medical physicians these days, they're just simply bypassing those guidelines, either because they're yet to become aware of them, or because they're just willfully sidestepping them. And is that ego? Is it ignorance? Is it just willful disobedience? Who knows? But regardless of the reason, clinics that can help these people and clinics that fit firmly within these newer guidelines, we're still not yet inundated with referrals from medical professionals. Not yet anyways. Some new information that just came out in February of 2021, that is brand new, is that 32% of low back pain patients, their pain progresses from being short-lived, easy to take care of pain, from that into being long-term, hard to get rid of chronic pain. And many of the patients that saw their pain progress to the chronic stage, they were actually at very low to medium risk of developing the chronic pain, but they did anyways for some reason, right? Well, it seems that one of the biggest factors for the pain in these patients becoming long-term chronic and difficult was that many of them went through the wrong treatment first. In the first 21 days, if you go through the wrong treatment, your chances of it becoming complicated and long-term, they go way up. So the wrong treatment are things like pain meds, shots, recommendations to just sit still and let it pass while you take some pain medications, and things like unnecessary x-rays, MRIs, or CTs before they're recommended. Now, believe it or not, the first treatment you receive, or the treatment you receive first, it really goes a long way toward how well you recover, if you recover at all. It matters a lot, especially that first 21 days. Now, the Veterans Administration, the VA, they have made a huge step forward. I got to give them compliments and kudos. The VA now commonly sends their vets to chiropractors, acupuncturists, and other conservative care practitioners, and they're sending them to us as a way to offer their vets very effective treatment that's effective in the research, all the while making inroads toward getting these vets out of pain, getting them better sleep, and getting them more involved in their lives, getting them more active and confident. And it's been a lot of fun to see these vets start to make the turn after they come and treat with us here at Creekstone Integrated Care. Spinal manipulative therapy, performed by an evidence-based, patient-centered chiropractor who knows how to identify and implement targeted exercise protocols, as well as using low-level laser, acupuncture, and massage techniques. This kind of practitioner is your first choice for treatment of back pain, and it does not matter how long you've had the pain. Visits with this kind of chiropractor first, in my opinion, is your best chance at avoiding pain medication, costly and risky steroid shots, prolonged unnecessary pain, and eventual unnecessary surgery, even if you're at low risk. Now listen to the largest, most influential medical associations and organizations when they tell you that spinal manipulative therapy, massage, exercise, acupuncture, heat, and low-level laser should all be tried first and failed before you ever start taking any kind of pills. They know what they're talking about. And evidence-based, patient-centered chiropractors know how to do all of this. If you're watching this on YouTube, we'd love for you to subscribe and share this video. If you're watching on Facebook, a like and a share would be amazing of you. Someone you know needs this information. If you're from the Amarillo area, or you're going to be passing through our area and you need to be on our schedule, be sure to call us, 355-3000. Let us help get you on the right track from the very, very beginning. Until next week, again, I'm Dr. Jeff Williams with Creekstone Integrated Care here in Amarillo, Texas. Take care. We'll see you then.